Hey, what's up? This is Corey Dion Lewis, founder of Healthy Project Media and the host of the Healthy Project podcast. Join me as I speak with change makers who are doing the work and sharing their stories, insights, and innovations to close gaps in healthcare for everyone. What's up, everybody? Welcome back to the Healthy Project podcast. I'm your host, Corey Dion Lewis, public health storyteller and somebody who's been watching what's happening in this country and feeling a deep need to talk about it. Um, Today is a solo episode, no guest. It's just me, you, and something that I think deserves your full attention. Now, we're talking about the systemic dismantling of the CDC, and more importantly, what that actually means for Black and Brown communities, low income communities, communities that were already one government decision away from a health crisis. I want to start by just being real with you. A lot of people hear CDC and they think that's where the COVID announcement came from. That's the agency that told me to wear a mask. And honestly, after everything we went through during the pandemic, I get why some people have complicated feelings about them. But here's what the CDC actually is at the ground level. And this part is important. The CDC is the funding pipeline that keeps local public health alive. About 80% of the CDC's domestic budget doesn't stay in Atlanta. It flows directly out to state health departments, local health departments, community health centers, nonprofits, clinics, and tribal organizations all across the country. It funds the people who track disease outbreaks in your city, the nurses who run free vaccination clinics, the programs that specifically address why Black people die from diabetes, heart disease, and cancer at higher rates than everyone else. HIV prevention programs in communities that are still disproportionately impacted. Um, the lead poisoning programs for children in cities with old pipes. When we say the CDC is getting cut, we mean all of that is getting cut. Here's what we know. The proposed federal budget for fiscal year 2026 would cut the CDC's budget by more than 50%, more than half. Over 100 programs and funding lines would be eliminated entirely. 61 programs at the CDC alone, 40 more at SAMHSA, which handles substance abuse and mental health. Let me say that again because I don't think it fully lands when you hear it as a number. Programs focused on cancer prevention, gone. Diabetes prevention, gone. Heart disease and stroke, out of here. Opioid recovery, gone. Global and domestic HIV/AIDS prevention, no more. And it's not just the budget proposal, cuts are already happening. In February of this year, the CDC canceled hundreds of millions of dollars in grants to states and communities, just ending them. States like Minnesota, Illinois, California, they're already suing, they're already laying off disease surveillance workers, epidemiologists, public health nurses. Minnesota alone lost 57 disease surveillance positions. And Illinois is losing 99 public health employees. Now, here's the part that made me kind of stop a little bit. When the Milwaukee Health Department needed CDC support to deal with high lead levels in their public schools, they called the CDC for help. And the CDC had to tell them no. And it's not because they didn't want to help, because every single staffer in the CDC's childhood lead poisoning program had already been placed on administrative leave. So the people whose entire job was to protect children from lead poisoning, gone. And a city full of children with lead in their water had nowhere to turn. There's no policy debate. That's a public health emergency and is hiding in plain sight. So let me answer the question I asked at the top. When the CDC dies, not metaphorically, but operationally, when it becomes, as one public health expert put it, a much smaller infectious disease agency stripped of everything else, who actually dies? Now, it's not the people with good insurance and the concierge doctor, but the people whose neighborhood grocery store has fresh produce, not the people who can afford to take 3 days off when their child gets sick. The people who die are the people who are already depending on a safety net that this country has never been fully committed to building in the first place. Black women who already face the highest maternal mortality rate in this country and who are starting to see some of the gap close because of targeted equity programs, those programs are being cut. Historically excluded communities where diabetes and heart disease rates are 2, 3, 4 times higher than they should be, the prevention programs that were starting to address those gaps are cut. LGBTQ youth who are already navigating narrow pathways to mental health care, those programs gone. Here's what makes me the most concerned as someone who works in public health every day. The Office of Minority Health, the office inside the federal government whose entire purpose was to improve health outcomes for Black, Brown, Indigenous, and low income communities, has been gutted. The CDC's version, the one at CMS, gone. The Arkansas Department of Health shut down its own minority health office. States are following the federal government's lead and dismantling the infrastructure piece by piece. One researcher said it plainly: equity work is not an optional initiative. It is the safety net that prevents avoidable harm. When equity infrastructure weakens, people die. This is more than just a talking point. It's a fact. Now, I want to take a second to name what's happening because I think it's important to call it out directly. The way these cuts are being talked about publicly is a waste. Fraud and abuse. It's cutting the bloat. It's ending DEI programs. It's making government more efficient. But notice what gets labeled as DEI. HIV prevention programs targeting Black women. DEI. Lead poisoning protection for children in low income neighborhoods. DEI. Cancer prevention in communities with higher cancer rates. DEI. Maternal health programs for Black mothers. DEI. If protecting communities that have historically been underserved and underprotected is somehow ideological, then what does that say about who we've decided doesn't deserve protection? Now, I'm not saying this to be political. I'm saying it because words matter, right? And the way we frame these cuts determine whether people understand what's actually being lost. And when you call it cutting DEI, people just shrug. When you say the program that was keeping Black mothers alive is being eliminated, that's a different conversation. Our job as a community is to refuse the reframing and tell the real story. I want to bring this home for a minute. I work. I'm a public health advocate here in Iowa. Um, I I work with community health centers, FQHCs, that serve the people most dependent on Medicaid, on public health programs, on that CDC pipeline we talked about. And I can tell you, The anxiety is real. Programs are operating at reduced capacity. Teams have been cut. We're doing They're doing more with less, and less keeps getting smaller. The thing about public health infrastructure is that you don't notice it until it's gone. You don't feel the disease surveillance system working until the outbreak happens and nobody can track it. You don't feel the prevention programs working until the preventable death happens that shouldn't have. We built these systems over decades, and it's being dismantled in months. And the communities who built trust with these programs, who were just starting to engage, just starting to show up for screenings and checkups and preventative care, they're going to walk into a room that used to have resources and find it empty. And then we're going to wonder why trust in the healthcare system is low. So what do? We stay informed, not just from mainstream news, but from public health voices who are translating what's happening without the spin. That's what this show exists to do. We use our voices. Your city council members, your state legislators, they are closer to you than you think, and they are making decisions right now about whether to fight these cuts or go along with them. Call them, email them, and show up. We will tell the story correctly. That's the third thing. When you hear someone say they're just cutting DEI programs, push back. Ask them to name what's actually being cut, because when you put a real face and a real consequence on it, it stops being abstract. And lastly, if you are in a community health center, a local health department, a clinic that serves underserved communities, know that your work matters more right now than it ever has. The infrastructure is getting smaller, the need is getting bigger, and you are a bridge for somebody. We don't get to be passive right now, and the stakes are just too high. All right. I'm Corey Dion Lewis. This is the Healthy Project Podcast. If this episode meant something to you, please share it. Leave a review. Send it to somebody who needs to hear it, because people who are making these decisions are counting on our communities not paying attention. So let's prove them wrong. Again, my name is Corey Dion Lewis. I'll holler at you next time. Hey, thanks for joining us on the Healthy Project Podcast. At Healthy Project Media, our mission is to connect with the next generation of health leaders and innovators. If you're interested in advertising with us or exploring collaboration opportunities, please reach out at hello@healthyprojectmedia.com. We look forward to growing this community together. Until next time, keep pushing the boundaries of health.